In Module 4, we will learn about communication barriers and how to remove these barriers by using disability-inclusive communication approaches when delivering healthcare or health information. In this first video, we will discuss why removing communication barriers is important, why they occur, and some common communication barriers that occur in healthcare settings. Let us first consider why it is important that our communications in healthcare are disability inclusive. People with disability have the same rights to access health information and services as people without disability, and promoting health literacy is also important for empowering people with disability to improve their own health outcomes. However, it is well established that people with disability across all settings have less access to information about health services, and their health rights and needs than people without disability. Communication barriers experienced by people with disability can reduce demand for health services and result in greater unmet health needs among people with disability. Removing communication barriers enables people with disability to have equal access to health information. Being informed allows people to have greater control over and the opportunity to improve their own health outcomes. Let us again recall the steps along the patient's healthcare journey. There is potential for communication barriers to occur at every step along the way, before, during, and after receiving health services. Keeping in mind that communication in health refers to both communication during interactions between health workers and patients, and in health promotion materials and activities, and in public health messaging. For example, communication barriers may prevent someone from knowing about the availability of a health service or program in the first place, or may occur when making an appointment, being greeted by a receptionist, during a consultation, arranging follow-up appointments, understanding prescriptions and labels on medicines, or even being able to follow signage within a health facility. These are just a few examples, but all have potential implications for the health and healthcare of people with disability. A range of factors contribute to communication barriers experienced by people with disability when accessing health information and services. When health workers have inaccurate ideas about the health needs and rights of people with disability, such as some of the negative attitudes discussed in Module 2, they tend not to offer important health information or do not offer it in the same extent that they would to a person without disability. People with disability that have impairments that affect their hearing, seeing, speaking, reading, writing, memory, or processing of information may need alternative forms of communication or adaptations to the way in which information is communicated. These are often not accommodated in healthcare settings. Many people with disability have had limited opportunities to attend school and therefore have not had access to health education or health promotion programs provided through schools, and may have lower levels of literacy, impacting their ability to read and understand written health information. Low levels of health knowledge or health literacy among the family members and carers of people with disability can also contribute to people with disability not receiving some health information or receiving inadequate information. You will note that many of the common communication barriers faced by people with disability when accessing healthcare, described on this slide and the next, stem from poor awareness of disability or attitudinal barriers. If you have already completed Module 2, hopefully you are already aware of the need for disability-inclusive attitudes in healthcare and may have already adapted some of your communications and overcome some of these communication barriers. Some common communication barriers include receiving inadequate explanations of health conditions or procedures due to a lack of alternative communication formats or assuming the person will not understand the information. This can result in people with disability not knowing what to expect during physical examinations or not having all the information that they need. Secondly, written health information such as pamphlets or brochures on specific health topics or prescriptions and medicine information is rarely provided in accessible formats for those for whom written form is not appropriate. Similarly, alternative or accessible formats are often not provided for verbal information, such as during consultations. People who are deaf or hard of hearing report very limited availability of sign language interpreters during appointments. And for people with cognitive impairments who may have difficulty processing information, supplementing verbal information with simple visual supports is similarly rarely used. People with disability also report being talked down to or patronised by staff in health facilities, including by health workers, and of being ignored entirely or spoken to indirectly through a family member or support person, rather than communication being directed to them. A further barrier is insufficient time made available in consultations for health workers to use alternative communication methods and ensure the person with disability has understood information and had the opportunity to ask questions. The impact of these communication barriers is that people with disability miss out on the important opportunity to receive adequate and often vital health information to make informed choices and have control over their own health and healthcare. As well as during individual appointments and consultations, people with disability experience communication barriers in relation to health promotion activities and public health messaging. This was evident in the early stages of the COVID-19 pandemic, when many countries did not initially use sign language interpretation during live broadcasts of important health messages. Many health promotion campaigns provide information in either one or a very limited number of formats, for example, only through posters and brochures, or only through television and radio campaigns. While posters and brochures might be accessible to people with some types of impairment, for example, people who are deaf or hard of hearing and people with mobility impairments, people who are blind or have a vision impairment cannot read written health information unless it is provided in braille or large print. People with hearing impairment, similarly, cannot receive information broadcast via only radio campaigns or television if sign language or captioning is not provided. And complex health promotion messages can be confusing to people with intellectual disability without attempts to provide visual supports or easy-to-read formats. Specific reference to or inclusion of people with disability is also often absent from health promotion materials and campaigns. A lot of health information usually does not include information specifically relevant to people with disability or answer questions they might have, and images of people with disability are rarely included on posters or brochures aimed at the general community. This serves as a further barrier for people with disability in receiving or engaging in important health information. Hopefully, you now have a good understanding of when and how communication barriers can occur in healthcare. In step 3, we will use this knowledge in an activity to further explore the impact of communication barriers on equal access to healthcare for people with disability. Return now to the workbook and complete this activity.